Welcome to Joy in Our Town. I'm Lisa Boldo, and our topic today is health. Joining me is Tammy Kohlschmidt, a certified clinical thermographer for Thermography for Health New York here in New York City. Welcome, Tammy. Thanks for joining us today.
Thank you, Lisa. I'm happy to be here.
And we're happy to have you. I want to dive right in because thermography, it just seems like such a great subject, and I'm sure our viewers are anxious to learn as well. So just tell us, what is thermal imaging?
Okay, thermal imaging or thermography is a non-radiation, non-invasive tool to look inside the body and see if disease is forming. It's an early detection device for disease. And it's done with a video camera. The images that the camera picks up are your body's heat patterns. So when you're looking at thermal images, you're actually looking at the temperature changes in the body. The important thing to know about that is if one body part is hotter or colder than the other body part, there's disease present. So you're measuring you against you.
Very interesting.
It is very interesting.
Really good. So what kind of things can thermography detect?
Thermography is best used as early detection, early disease detection. It shows risk factors, but it also will pick up inflammation, infections, tumors, and new blood vessels that are forming around the tumor, digestive stagnation, lymphatic stagnation, nerve disorders, allergies. The list is quite lengthy of what it can detect. And it's all done by measuring, again, your body's heat and cold patterns. You know, thermography was actually developed in the 1800s.
Oh, wow.
It's been around a long time. And it was recently approved by the FDA in 1982. Its history dates back even before that, when the Egyptians would put mud on a person's body, and where the mud dried first is where usually the disease was present.
That's amazing.
So heat has been a factor in health since the beginning.
Wow, and I know it uses the infrared lighting, right, to detect all that.
The camera measures your infrared body temperature.
That's amazing. So mammograms versus thermograms, what would you say about that?
Hot topic. So thermography measures physiology, which is your tissues and your cells. And there's zero radiation. There's no body contact, so there's no compression. It's safe, effective, and harmless. Mammograms measure structure. So a tumor has to be in the breast for 8 years before a mammogram will pick it up.
Oh, wow.
Thermography will find a tumor at 2 years, which is about the size of a grain of rice. Mammograms at 8 years is the size of a dime, the tumor. And on top of that, the worst part, besides the compression and the squeezing of the tissue, is the amount of radiation you're getting.
Right.
So I think thermography is your best way to assess early disease detection before it becomes a problem.
Certainly sounds like it. And so how often would you say a thermogram should be taken?
Well, there's two answers to that. The first one is you get your first images done. You can do just a breast study, or you can do an entire health screening. When you get your images done, you come back 3 months later and you have your second images done of your breasts and your digestive system. And this establishes your baseline, or what we call a thermal thumbprint, so that you know what is healthy and normal for you in that 3-month time. Because we're measuring physiology, we're measuring temperature changes. So if things are going to change, they're going to either go good or bad, and that's how you get your baseline.
So, I mean, health screening is important. Why do you think that's so important?
Well, it's important because you look into the body, you can see risk factors, you can see things developing before you feel them. The problem with once you feel something is that it's now a symptom and the ball is already rolling. So if you can catch things in early cellular formation before you feel them, now you can do protocols and you can easily change your cells back to health.
Wow. And so can thermal imaging be used, say, for example, if someone has cancer?
Yes. It's a tracking device. Okay, so let's say a woman comes in with breast cancer. and she's either going to take the traditional route with chemo and radiation and surgery, or she's going to take more of a holistic, natural route. Whichever way you decide to go, you can come in and get pictures taken, and you can see if the treatment protocol is working. Is the tumor shrinking? Is the tumor getting bigger? Is it staying the same? So it's a tracking device. And it's also good, you know, we were talking about health screenings. Men can get thermograms too.
Yeah, that was going to be a question.
Okay.
That's great.
Yeah, because it's not just women and breast. It's digestion, it's prostate. And men can get breast cancer also. 1% of men do have breast cancer.
That's pretty amazing. And so it can detect things within your digestive system, because I know a lot of people out there struggle with that.
Absolutely.
So this thermal imaging, it's diagnostic testing, basically.
It's, well, it's not diagnostic. It's adjunctive, and it's assessment tool. The only thing that really is diagnostic is a biopsy, because it's actually testing the cells.
Okay.
So we like to think of thermal imaging as a detective tool. So it can definitely tell you that there's things going on. It just can't say for sure. So you would always follow up with other clinical sources.
And then after someone does the thermal imaging, 3 months later, you said you would come back and maybe do it again, or how does that work?
Yes, you would, depends on what your issue is, but you would come back 3 months later, get the pictures taken again, and in those 3 months, you would have been given recommendations and protocols to follow to change those cells, to bring you back to a state of health.
That sounds fantastic. And so, you know, I asked you before, I mean, how often can somebody do it?
You can do it as often as you want. There's no
safe?
radiation, yes, but it's done annually. It's a once-a-year thing. Once you establish your baseline, once a year.
That's really good.
Yeah.
So as a dental hygienist, what motivated you to get involved with thermal imaging?
Okay, as a dental hygienist, I look in the mouth all day long, and I see inflammation, I see the tongue breaking down, I see the teeth breaking down. So I always am looking at this, and I know that if that's happening in your mouth, it's happening in your body.
Yeah.
Because your mouth mirrors your body. It's a barometer to your overall health. So when I heard about thermal imaging, I was like awestruck. I thought, this is perfect. Now I can actually look in the body and correlate what I'm finding in the mouth to their digestive system, their liver, their gallbladder, you know, whatever it may be. And, you know, cancer can come from diseases in the mouth. So it's not a cut off at the neck kind of deal. The whole body is one system.
Yep.
We're all connected.
And so with the thermal imaging, what different types of holistic approaches might someone do after getting results?
Okay, so let's say your results comes back with stagnation in the digestion. When you think about cancer, there's 3 things you want to hone in on. Are the hormones in balance? Is the lymphatic system draining? Because our lymphatic system carries our wastes and toxins.
Right.
So if it's not draining through the body, wherever it's stagnant, the cells become acidic, bathing in toxins.
Right.
And the 3rd thing is digestion. So the protocols and the recommendations will come back focusing on those things, because those 3 things show up in a thermal imaging pattern through either hot or cold, or they make different patterns in the body when you're looking at it. So you'll get, if it's digestion, you may need to take some internal clays, different types of fibers. You may need enzymes. You may need hydrochloric acid for the stomach. It really depends on what the issues show. Your body will tell us.
Yeah, and nutritionally as well, right?
Yeah.
Because you're definitely going to need some nutrition changes.
Absolutely.
Yeah, that's wonderful. So how can thermography be used in dentistry?
Thank you for asking that. So, as I said before, when you're looking in the mouth and you can see the breakdown and then you have the body, we use thermography to picture the head and the neck and the jaw joints, because you can see inflammation around the jaw joint that a person may not feel, but it's there. And that can signify infection, it can signify inflammation. You can see periodontal disease in the gums. Wow. You can tell if there's heat around a certain tooth. So you'll know to go deeper. It's just more information that we don't always see with our eyes.
I think it's amazing. So if you were to say to our viewers out there, just a tip for them, I mean, just give us what do you recommend? I mean, let's do a thermogram. Let's, maybe not kind of steer away maybe from the mammogram.
Yeah.
For now. It's much safer.
The thing of it is our model of health right now seems to be a sick model, a disease model, and thermography gives a person a chance to create their own model and go towards health.
Yes.
So it gives you a chance to look in your body, see where the weaknesses are or the risk factors, do the protocols, which are usually easy. They don't require a lot. And then come back 3 months later and see your body change. And everyone feels better.
And you're not really taking medications per se. It's all a holistic approach, natural.
Yeah, there are some exercises involved. A lot to do with the spine because the nerves from the spine are a major part of your digestion. Huge. Your digestive system is a lot of nervous system. So there will be exercises you can do to free up your nervous system, which will get your digestion moving.
That's fantastic.
Yeah.
So how can our viewers maybe find out a little more about you?
The website.
The website.
At www.thermographyforhealthnewyork.com. You can spell out New York or you can just type in NY. And there's a free chapter of a book from Breast Wisdom. You can download that free chapter and read all about thermography and mammograms.
Oh, I think
educate yourself.
That's fantastic.
Yeah.
This has just been a plethora of information. I mean, I know I'm interested myself, so I would just say, thank you so much. And
thank you.
I just really appreciate your information, and I know our viewers do too.
Thank you, Lisa.
Thank you so much. And thank you for watching, and we will be right back.